I'm Diane Stevens, Chief Executive of TOFS. So we do hope that there is some awareness amongst the adult community of the work that's going on to support patients beyond the days of paediatric care. And the vision shared by everyone at TOFS is quite simply, patients should live long and healthy lives without their health and well-being being adversely impacted by being born with OA TOF. And sadly, we know and we hear today, and we hear it probably on a daily basis, I would say, that that isn't the case for all adult patients currently. Far from it, in fact, for some of you, because certainly some of you at this meeting even continue to have significant problems. So as a charity, we're really passionate about affecting change, although we do have to recognise that sadly, it's not going to happen overnight. But it was really encouraging hearing what Professor Spannder had to say, and so many developments since she last spoke at our event in London, for those of you who attended that back in 2018. And all of this we will be sharing with members of our medical advisory group, who are mainly paediatric clinicians, but we'll be talking to them and asking them how we as a charity can continue to exert influence and just chip away at the people who are responsible for adult care here in the UK. So some of you will be aware of our Adult TOF Working Group, and this is a group of really committed volunteers, all adults born with OA TOF, who are working alongside us in various ways, producing resources, raising awareness amongst health professionals, and their work is making a real difference. So I'm now going to pass you on to Kate Tyler, who's doing a fantastic job of leading the group. So thanks to everybody for joining us today. Enjoy the rest of the morning.
Thank you, Diane. I hope everybody can hear me.
We can?
Yep, okay. As Diane said, my name's Kate Tyler. I was born with esophageal atresia, Tracheo-Oesophageal Fistula, anal rectal malformation, and other anomalies. I've been a member of the TOFS charity for a few years and have gained tremendous benefit from attending their conferences, meeting other adults and parents and professionals along the way, accessing the website, and reading some absolutely inspiring stories in the Chew magazine. Last year, I was approached by the charity in regard to increased engagement and support for adults born with OA TOF. This coincided with the work that Dr. Caroline Love, also an adult TOF, was doing for TOFS in the creation of the Adult OA TOF Management Handbook. For anyone who's interested in this, it's available in a digital format via the website. Thank you, Caroline. There's a huge amount of work that's gone into this handbook. It was quickly realised that the management handbook was going to be a very detailed document, and from it a pamphlet could be developed. At this point, a small group of adult TOFs came together to take the idea forward. This group, as Diane said, is known as the Adult TOF Working Group, or ATWG for short. It consists of people born with different types of TOF and some with additional anomalies. We live in different parts of the world, stretching to Scotland, the south of England, the Midlands, and even across to the west coast of the USA. It's important to recognise that at all times we've been supported by Diane, Sue and Claire, without whose guidance and assistance we would almost certainly have stumbled at the first hurdle. Our monthly meetings are held via Zoom, and despite the fact that most of us have never met face-to-face, this method seems to be working out well, and we're forging forwards, sharing our ideas from our lived experience of OA TOF. Our initial task was to work with Caroline and tease out important facts from the handbook to put into the new pamphlet, which we called Improving Health Outcomes for Adults Born with OA TOF and VACTERL. This is also available to download from the TOFS website. The purpose of the pamphlet is to advise, inform, and support adults and transitioning young people, to help them have a voice when faced with health professionals who've never heard of OA TOF, or professionals who are reluctant to refer to specialists further afield for respiratory and/or gastric investigations. To help us to explain to those professionals who sometimes think we are fixed at birth and do not appreciate the chronic health problems we may encounter as we age. The pamphlet will hopefully empower adults to self-advocate, to be signposted to professionals who understand our condition. We hope it will help those born with OA TOF to live their best life. Our next group task has been to develop a banner focusing on adult respiratory health issues. This is a new project for TOFS. We plan to take the banner to the British Thoracic Society conference in Manchester later this month, where TOFS has a stand for 2 days. In addition to this, we've designed an A4 handout for conference attendees to take home. The banner and the handout are intended to inform health professionals that we are at high risk of chronic health problems and should receive regular follow-up by expert multidisciplinary teams, lifelong care, a message we must keep repeating. This new direction in patient advocacy is demonstrated in the TOFS position paper towards a holistic model for the treatment of those born with OA from diagnosis to transition and adult care, written by Graham, also an adult TOF, and Julia, a parent of a child with TOF. This again is available, if anyone's interested, to download from the website. In addition to these achievements, the group is looking to extend support to those born with additional anomalies, particularly within the VACTERL spectrum, and develop links with other networks, charities, and support groups. In my opinion, collaboration, the sharing of knowledge, to wherever possible address uncertainty and allay anxieties should be part of our group remit. The Adult TOF Working Group has provided the opportunity for those who have first-hand experience of living with OA TOF to make a difference. The individual experiences shared within the group are precious and humbling, and I thank all members for their enthusiasm, their kindness, and their support. Thank you, Diane.
Thanks very much, Kate. That's brilliant.